Your Health Matters OC. My name is Jenna Sarin, and I have the privilege of serving here as the healthcare agency's Chief Nursing Officer, filling in this evening for Dr. Clayton Chow, the healthcare agency director. Joining me this evening, we have Dr. Regina Chincio Kwong, Dr. CK, who many of you know, of course, as our county health officer, and also an esteemed colleague, Dr. Joey G., who is a neurologist with Mission Heritage Medical Group Providence. And thank you so much, Dr. G., for being here. And welcome everyone to the show. We're certainly excited to have you here tonight, both in the studio and watching online. And this evening, we're going to be talking about the topic of long COVID, or long haul COVID, because it is known by a handful of names. But before we jump into our main topic, Dr. CK, can you kindly give us an update on the current stats in Orange County with COVID, as well as another respiratory disease that has certainly been problematic for our little ones, RSV?
Yes, definitely. So just looking at our case rates for COVID have decreased to 4.9 per 100,000, but we did see an increase in our positivity rate to 5.3%. As far as our hospitalizations ticked up just a little bit from the last time we reported. Our hospitalizations are now at 118, and our ICU admissions also increased slightly to 14. The majority of those patients who are requiring hospitalization still remain those who are incompletely vaccinated with the COVID primary series. So really encourage everyone, if you haven't already completed your primary series, please do so, and please get boosted. Next slide. For vaccination, there hasn't been much change in terms of the percentage of folks who have been vaccinated. Our children aged 6 months to 4 years remains at 8% for at least one dose, and then 4% fully vaccinated. And again, you can see the rest of the stats with our 5 to 11, 12 to 17, and 65-year-olds. I think the 65-year-olds are still doing the best in terms of getting their bivalent vaccines. And then I just want to show another slide too, that so there have been a lot of updates with the vaccines that are now available to the public. Bivalent vaccines are now available for those who are age 5 and up, as long as you have completed your primary series, and as long as it's been 2 months since completing your primary series or since your last booster dose. We do have primary series available for 6 months and up, and also Novavax has been recently authorized to be used in specific situations where those who are 18 and up who have completed their primary series and for whatever reason are not able to receive the bivalent mRNA booster, can actually receive the Novavax 6 months later, as long if they are not able to receive the bivalent booster, or for medical reasons, or if they are not willing to and want to do another option. Next slide. So in terms of monkeypox, our cases really have stabilized and really reduced. Our total cases is now 286. Really hasn't changed much from our last report, and hospitalizations now are a total of 15, which is only up by 1 since we last reported. Also, we're doing a great job with vaccinating. So if any of you out there who feel that you're at risk of getting monkeypox because of other risk factors you may have heard on the news or on our website, you can actually look at othina.com for more information, or our website, Your Health, or OCHealthInfo.com/monkeypox, and you'll find information about the eligibility for Jynneos vaccine. We are still administering that at no cost for those who are at risk. And the next thing I want to talk about is RSV. So yesterday I did sign a declaration of health emergency for RSV and respiratory illnesses in children. Unfortunately, our pediatric hospitals are significantly impacted by the high number of individuals requesting for evaluation in our emergency departments or needing hospitalization at our pediatric hospitals. So at this time, there's still a lot that the public can do to protect themselves from getting respiratory illnesses. And that means you can do what we've been doing here. We're all masking up, especially at schools, daycares, as long as you're 2 and up. We've done this for the last 2 years, and we know it works because we have seen a decline in respiratory illnesses such as flu as well as RSV in the last 2 years with the use of these mitigation factors. But this year, what we see is a significant incline when it comes to RSV and a lot of other respiratory illnesses that also affected us this summer, as well as flu. So again, we want you to mask back up, at least to reduce the risk of getting sick or transmitting illness to others. Now, RSV is a common virus that can infect adults as well as children, but is more commonly affecting the younger children because they have small airways, and it's usually the infants who are at highest risk. But also other children who have other comorbidities may be at risk of developing severe illness from RSV. Typically, the RSV season is at around the end of fall into the early winter and into February, similar to the flu season. But since the pandemic, we had low numbers until this year. We actually saw a rise in RSV during the summer, which was not common, and we weren't expecting that. And now, as you see on this table provided by CHOC, the red line shows you the number of RSV cases that they have seen. And you can see there at the very tail end, that is significantly risen up beyond what we have seen even last year. And we don't know when that peak is going to be, but the staff at our children's hospitals have been strained for the last couple months, starting in August, when they started taking care of those who had rhinovirus or enterovirus, which is the black line on that table. Also, our flu cases are starting to pick up. So we are potentially going into what people are calling the triple-demic or tridemic. What we're seeing mostly is, again, RSV and other respiratory illnesses, and now is the time for us to take preventive measures to reduce the impacts on our hospitals. If your child has symptoms, concerning symptoms, like maybe their lips are getting blue, they look dehydrated, they're acting really funny, they're lethargic, or they're grunting. Some infants will grunt when they breathe. That's not a good sign. You need to go to the emergency room. Of course, on your way there, you can contact the hospital, but please go to an emergency room, even if the wait is long, because your child needs to be seen. For other non-emergency issues, like maybe your child is continuing to have low-grade fevers, but is responding to medications, otherwise looks healthy, you want them to be seen, you can use urgent cares to contact your primary care provider. There's telehealth visits to at least get you started, and then from there, the healthcare provider can navigate you to other care. But that can help reduce the impact on emergency rooms, because it sounds like the emergency wait time room at the emergency rooms is pretty long. At the press conference we had earlier today, the wait can be anywhere from 5 to 12 hours. So we want parents to be ready, to be prepared, to be preventive, and reducing the risk for respiratory illnesses. And RSV can also affect older populations, especially those who are 65 and older. So again, we want to protect everyone in our community. I think that's all I have in terms of COVID, monkeypox, and RSV.
Great. Well, thank you so much, Dr. CK, for those important updates. To the audience, as a reminder, if you're just tuning in or started with us, if you have questions about any of the topics that we're covering this evening, please send those to us via email at yourhealthmatters.ochca.com. And again, yourhealthmatters@ochca.com. We're putting that website up for you now, so please feel free to send questions our way.
I forgot to add one more
Sure.
thing. I'm so sorry. So flu, we did have a slide. For those who are 65 and older, it is important, actually 6 months and older, who are eligible for flu vaccine, please get your flu vaccine, because we are also expecting a severe flu season. For those who are 65 and older, know that there are 3 authorized flu vaccines specific for you that can increase your immunity against flu, because these are actually specifically formulated to have either higher doses to increase your immune response compared to a regular flu dose. But if you are not able to get one of these 3 different flu vaccines, it's okay to get a regular flu vaccine.
Great. Thank you again, Dr. CK. So just again, as a reminder and summary, as we've just passed Halloween and are headed straight into the holiday season, we want to make sure that all of you and your families are taking the appropriate steps for preventing COVID during the holidays. Please remember, as Dr. CK said, vaccinate, have testing handy if that's needed for you and your family. Stay home if you're sick, please. Mask whenever you can in public spaces to protect yourself and others, and have an alternative plan in case people are sick. We're going to now go ahead and take a quick break to watch a simple message about why even our young people are choosing to get the COVID-19 vaccine. And so with that, we're going to go to our first video.
I got my daughter the COVID-19 vaccine to keep her safe.
I got the shot so I can safely see my friends again.
I got the vaccine so I could visit my grandparents.
I got vaccinated because it's the best chance I have to stay safe from the COVID-19 virus.
The COVID-19 vaccine is safe and very effective at protecting you and your family from the serious and long-term effects of the virus. It's up to us to stop this pandemic and keep our kids and community safe.
Great. Welcome back, everybody. I hope you found that information to be helpful, put out by the American Academy of Pediatrics. So now we're going to switch gears a little bit and talk with our expert about long COVID. Dr. CK, if you'd like to kick us off with just a little bit of information as an intro as to what does long COVID look like? What are some of the symptoms that we might see and that patients might experience and should be aware of?
Right, so long COVID can come in many different forms, and I'm sure Dr. G can talk more about it, but some of the symptoms are very vague, and they can occur in people who had no symptoms at all with COVID or had mild symptoms. More commonly, it will be for those who actually had COVID symptoms, and it can be immediately following the illness, the acute illness, or it can actually arise months after the illness. So the symptoms include a long range of things, including having a cough, a chronic cough, so a cough that persists beyond 4 weeks or into 3 months, fatigue, also shortness of breath are some of the most common symptoms, a chronic headache, muscle aches, intermittent fevers, breathlessness, I think I already talked about, difficulty in focusing, anxiety, depression, difficulty with sleep. Am I missing anything? Oh, there's a whole bunch, right? There's also joint pains, stomach issues, diarrhea, nausea, dizziness. I heard that one. That was an interesting case. Rashes that continue on or are new. And changes in your menstrual cycle. So here's a list, if I didn't already mention it, but this is just a small list of the range of symptoms that people can have anywhere from 1 month to even 3 months out from their original illness.
And from your experience, Dr. G, as a provider serving the community and so many patients and over the past few years and now seeing these types of cases, the symptoms, the consistency, what has been your experience as a provider in dealing with the symptomatology that patients are exhibiting?
Well, first I want to thank you both for having me here, and I hope to keep it simple because I don't want to go over anybody terribly medically, but many of the symptoms that Dr. CK just went over is what we are seeing. To kind of expand a little bit, the CDC guidelines looked at post-COVID and predominantly when the symptoms began. So at 4 weeks and beyond is then when we start to calculate they are in a case of long COVID. And it comes in many different forms. Many people are using the term post-COVID or COVID long hauler, but you might hear terms like post-acute COVID syndrome, chronic COVID syndrome, and the various symptoms. So to kind of break it down a little bit more, as a neurologist, I see most of the cases in people who are coming to me with specific neurological complaints. But in the field of the nervous system is that it involves the entire body. And unfortunately, COVID-19 has affected the entire body. So when you look at the list of symptoms that were displayed, and I don't know if we can display it again for the audience, you might want to look how the systems are broken down. So I'm a neurologist, so there is neurological disturbances in long hauler COVID. There's long-term or chronic pulmonary or lung-related conditions. There are long-term cardiac-related symptoms. There are dermatological conditions having to do with the skin. There is now up and coming more endocrine disorders, from hormonal disturbances to the development of diabetes mellitus, especially in some of the younger individuals who were afflicted by COVID-19. And then as the neurological field, you can't even really isolate down to any specificity because many of the symptoms we see are quite broad. So as you heard Dr. CK mention, probably the most common symptoms are very generalized. They're not one condition. So you're talking about patients who experience brain fog, which is one of the most common long-term complaints that people continue to experience, particularly in our workforce. And those are the individuals who are commenting from age 20 to even younger to older that they can't work the same. They're having struggles at work. So it has greatly impacted the socioeconomic status of working from any job. And then there's the fatigue, which is more generalized and broad, which can include both the brain, the lung, and the heart in regard to that level of fatigue. Pain. Pain, unfortunately, is something that we are seeing more often, and pain encompasses a many number of symptoms, from headache to joint pain to muscle pain to even back pain and neck pain. And one thing that we haven't really mentioned yet is the psychological impact that COVID-19 has had. Not just us having not been able to do the things we normally would like to do during the lockdowns and during the crisis of the pandemic, but those who have had COVID-19, we're seeing a greater number of individuals experiencing anxiety disorders and depressive mood disorders, along with the cognitive and brain fog. Early on in the pandemic, as COVID-19 was coming up in the original infection before Delta, many individuals didn't understand, as well as many medical providers didn't understand, why we continue to feel these particular symptoms. And I kind of want people to know it was almost similar to having a long-term head injury. And that's kind of how we got started, is we're seeing overlap with those who've had head trauma and many long-term COVID symptoms. So it's important to encounter an individual with COVID-19 who may have been exposed to COVID-19, go through many of these symptoms that we have from many of the systems: brain, lung, heart, skin, joint, psychiatric. Identify this, exclude other problems that we may not know and just blindly say it's long COVID. We must make sure there's not something else yet to identify, and then to trying to target treatments. And there's a lot of information out there. You'll have pulmonologists treat long COVID a certain way. You have neurologists treat long COVID a certain way. You'll have cardiologists look at long COVID a certain way. But unfortunately, I look at this as a community issue. We need to prevent getting COVID-19, identify symptoms that you may be experiencing, both acute and longer term, and then we need to treat you together with all the professionals. It can't be just one person.
So you mentioned something really important, that it's important to rule out other conditions that may have these symptoms, because I'm guessing a lot of people also go to you and say, I'm guessing this happens, I don't know, I haven't been in the patient realm for a while, but a lot of patients typically will self-diagnose and say, I think I have long COVID. How do you approach that patient and really still and hear them out, but also support them?
Well, you probably heard a number of times over when you meet a medical provider, the history is truly the key. And the more history we can gather and obtain, then we might identify or hear something we don't want to hear, or something that we call the red flag. So because COVID-19 has so many symptoms, we utilize forms with a list of symptoms for patients to document down to help us. But also, one very important question is to always ask, have you experienced any of these symptoms before this in any sort of way, in any way at all? You know, and sometimes they may say no, and that's fine. But then the examination is important. If there's something key or irregular, then that's something to identify. I had an individual who struggled what we believe was COVID-19, and I still do feel there are some post-COVID related symptoms, but there is something not quite right about this individual. I did a brain scan and we found a pituitary tumor. And left unchecked, it was probably going to add to some endocrine related conditions. So then you refer to an endocrinologist. And that's part of the community project to really get all hands on deck to help with these individuals.
Dr. G, how often in your patients, as you said, the history is so important, and in gathering the symptoms, are you hearing from the patients that the things that might lead them to believe, or why they might be seeking your expertise as long COVID, are different symptoms than maybe what they initially had when they developed the virus? So I'm wondering how often, you know, you're hearing different things, their symptoms are changing through their illness, and if that's a factor in your diagnosis as well.
So that is a very important thing. One of the factors is patients they may have some other chronic ongoing medical issues even before, and they will say it is different than that. And then I've had patients who told me, oh, by the by, I did have COVID-19. And it was this month or a certain month, and they kind of blew it off. And now I would be like, oh, wait a minute, let's back this up here. We gotta see how this plays into this. But one important thing that you have to know about the change in symptoms as well is patients who may have had COVID-19 and then do really well. They recover substantially well to the point they have no symptoms at all. And then suddenly they're experiencing vague complaints 1 month, 2 months, even 6 months later. Now, the longer it takes, like if they present with new symptoms at 1 month, 2 month, 3 month versus 6 months, 7 month, 8 month, that does make you wonder what else might be happening if they're really prolonged out versus more closer to the infection. Unfortunately, many individuals, their symptoms weren't significant enough to actually seek attention, and they struggled. They just struggled daily, and they didn't, and may often not even know who to go to. So early on, we saw some patients who were told it's all in their head, if you want to put it that way, and they continued to struggle. Like I said, what was really reflecting is a change in work productivity. Some people lost their jobs, and that hurts the community. So really, I don't know if I'm answering your question correctly, but the key is those who really became asymptomatic and then developed symptoms, or even those who may have contracted the virus, never knew they had symptoms at all, and then developed symptoms later. And that's harder because they may never have actually tested themselves.
We've obviously been talking, you know, throughout COVID, and especially this evening with the RSV circumstances as well, with young adults and young children. Can you tell us about your experience in caring for or having these types of cases in the younger population?
I want to make sure that I'm answering. So,
Sure.
so if we're talking about young adults and pediatrics
Right.
who may have had COVID-19, because we're mostly focused on COVID-19 and the symptom impact.
Correct.
Their symptoms are a little bit different than adults, but yet they're very similar. It's just how they are variable. Of course, younger individuals, kids, pediatrics, young adult, they tend to be more resilient and recover faster and are more adaptive. So you may not see, or they might not complain of anything long term. But it's interesting that when they do have symptoms, they are really in a disabled state. One of the things that you want to look for as a parent is their grades are dropping. And they may not tell you that they have brain fog or they're fatigued. Their exercise level and stamina has substantially diminished. So in that aspect, I might have to do, I'll ask, I or many other people will look at their pulmonary stats. Did their lungs get affected by the COVID that they didn't know? So an X-ray might see some changes to the lungs, the lung capacity. But I've seen a lot of young individuals with headaches. And so you kind of have to really understand their headache. And headaches is a very common condition. If I can dive a little bit on that, the current statistics in the United States is 1 out of 4 households have someone that they're living with a chronic headache disorder. So a headache condition is very common. There are 36 million people with migraine in the United States alone. So you have to deep dive a little bit and just say, oh, you just have a headache. Because children are underdiagnosed and undertreated with a headache condition. So there's often a very good causal relationship to when they may have had upper respiratory symptomatology, whether it's COVID-19 or another condition, and the development of that particular headache.
Thank you. Yeah, that's incredibly important, and I think appreciate your sharing things that parents can be aware of and to watch for that may not traditionally trigger that this is something related to COVID, especially if the child didn't have severe symptoms with the illness the first time. So thank you for sharing that. I know one of the things we wanted to talk about before we go to our next video is really looking at some of the data in California and perhaps other states. I believe we have a chart that we can bring up to, if Dr. CK can share a little bit with us in terms of what our numbers look like and how often is this occurring?
Right, so there are different estimates as to how much this is occurring, and some of the guidance is saying it could affect anywhere from 10 to 30% of individuals who have been infected with COVID. And so we have this one website from the American Academy of Physical Medicine and Rehab that was trying to estimate in Orange County, and actually you can use whichever county you're from to determine what are the potential cases that we're looking at for our population. So the estimate for Orange County could be anywhere from 70,000 to 200,000 cases. And so when you think about the long-term consequence and the potential disability for some individuals, that affects a significant portion of our population. So again, this is disheartening to see. We don't want any of our community to be suffering, but we know that they're out there suffering with long COVID symptoms.
Yeah, thank you. So our next video summarizes some of the symptoms of long COVID that Dr. G and Dr. CK have discussed. We're going to go ahead now and check out this video from news coverage on the topic of long COVID.
For some people, the impacts of COVID have become a daily part of their lives as they now suffer from long COVID. ABC 10 News has been reporting on this aspect of the pandemic since September 2020, introducing you to the people living with this, the doctors helping fight it, and the experts trying to solve it. Today, as part of our special coverage on the pandemic's 2-year point, ABC 10 News reporter Jared Aaron speaks with long COVID haulers about their journey from sickness to hope.
And Mama can carry him now. She can do this now.
For Jenica Harris, just being able to lift her son Rain is a minor miracle.
It feels like everything I dreamt of.
Harris has been fighting the effects of long COVID for 23 months. When we spoke with her in March of 2021, she told us everyday tasks were impossible.
Getting up from the couch to the bathroom was like running a marathon that never ended. I couldn't hold my son at the time. He was 7 months, and I couldn't hold him for months.
And he's quick.
Now she chases Rain around the backyard and says her life is 95% back to normal. But it took time and effort to reach this point.
I'd say about at a year and a half post-COVID is when I really started to see that turn, and it was me again.
Jenica saw countless doctors, went through more than a dozen prescriptions, did physical therapy, and enrolled in 8 scientific studies to find the right combination to get better. She still carries a small bag of inhalers, blood pressure monitors, and an oxygen meter everywhere she goes.
This is the inhaler that I take that is like my best friend.
It's her new normal, but it helps her live the life she wants.
It becomes a part of you, and it's not something that I'm saying this is forever, because I will fight hard until I can't anymore to try to do whatever I can do to get better.
While Jenica's story has a happy ending, that's not the case for millions of other people. The CDC estimates anywhere from 10 to 30% of people who get COVID will develop long COVID issues. Do the math. With nearly 80 million Americans getting infected over the last 2 years, that's anywhere from 8 to 24 million people with long COVID. Some of them won't get better, like Andrew Metza.
I can't walk. I can barely roll around in bed. Can't hardly feed myself.
We spoke with Andrew from his hospital room. He's still using a breathing tube more than 2 years after contracting the virus. It's a far cry from the bicycle-obsessed person he was in 2019.
On my days off and on the evenings and on the weekends, I was riding the Pacific Coast Highway. Loving it.
Now he calls his life a daily battle against long COVID and against a medical system that he says still hasn't grasped the full extent of the issue. He's been in and out of hospitals, clinics, and more.
Most of them hadn't even heard of long haul. I've had to educate the doctors and nurses all along the way.
Medical professionals are trying to catch up. UC San Diego Health opened one of the first long COVID clinics in the country. Director Dr. Lucy Horton says treating it is difficult because every patient is unique.
I certainly wish there was a kind of magic bullet for long COVID, but right now there isn't anything, and I'm not aware of anything on the horizon.
Dr. Horton believes long COVID care will become part of routine medicine going forward, another aspect of COVID becoming endemic. And as people like Andrew, Jenica, and millions of others get used to their new lives, they hope the rest of the world understands what they're going through.
For some people it goes away, but not a lot of us. It just doesn't go away.
Just have empathy for people. We're all trying our best.
Jared Aarons,
You too?
ABC 10 News.
Some studies have found COVID vaccines can help prevent long COVID or make the symptoms less severe. That's why Dr. Horton and the long COVID survivors we spoke with all said everyone should get vaccinated. Now, if you have a story that requires an in-depth look, just send us an email. There's the address, tips@10news.com.
Welcome back, everybody. Thank you so much for joining us for your Health Matters OC. Again, this evening we're talking about long COVID, and I know our coveted leader, Dr. Chow, isn't able to be with us, so thank you for supporting us tonight, and hopefully having some good conversation with us about the important topic that we're covering. Dr. CK, I know we were talking a little bit at the video about some of the basically populations and communities that might be more negatively impacted by long COVID. Can you share a little bit about that with us, please?
Yeah, actually there was a recent study that was published from the Household Pulse Survey, pretty much looking at individuals who continue to have symptoms beyond their acute COVID. And what they found was that it can affect 8%, nearly 1 in 13 U.S. Adults who have COVID conditions, and it was more likely to affect women than men, and also those were of color. So Hispanics and African American had higher rates of long COVID compared to other ethnicities. We do have a table that we can share that actually shows you the difference between females and males and who was more likely to get COVID. So females on this table shows that they had 18.2% higher risk of having long COVID compared to men. And then also the younger adults and middle-aged adults had more long COVID compared to the older adults. So there's a lot of different factors. Other things that the CDC looks at in terms of risk factors for developing COVID or long COVID is the severity of the COVID illness when they had the acute illness, underlying conditions prior to having COVID-19, patients with disabilities, the unvaccinated, so they tend to have a much higher risk of developing long COVID, or those who actually develop multi-system inflammatory syndrome in the acute phase of their illness. And again, we know that there's a lot of health inequities, that many specific populations were actually affected much more than others, and they're more likely also to have long COVID.
Thank you for sharing that. So I think next we really want to talk about what is being done to help treat people with long COVID. So some of the treatments, therapies. Dr. G, we've put your contact information on the screen. We're going to be doing that now. Since we know you're actively treating patients, can you please tell us about the treatment protocols and some of the things that you're seeing in terms of efficacy, et cetera, with your population?
Well, if we speak about Orange County, particular, but throughout the United States, there have been numerous centers that are dedicated as best we can to treat and to identify and treat people who have COVID-19 and long hauler COVID-19. Like I said, there are many clinics that are established, and you might see different providers at a particular clinic, a family practice doctor, versus a pulmonologist versus, for me, a neurologist. But if I speak about the clinic I work at, it is a multi-specialty, multidisciplinary group. We are not all in the same building, but we identify those who might require particular services. So so in Orange County, I'm not trying to advertise any one clinic or anything, UC Irvine and Providence, that I work for, we do have that workforce. I work for Providence, and we have facilities at St. Jude in Fullerton, St. Joseph in Orange, St. Mary's in the High Desert, and at Mission. And so we have isolated many providers who want to take care of people with COVID-19, pulmonologists, cardiologists, and so on. So one of the things is to try to, obviously, is identify those who may have those symptoms, exclude other secondary conditions that might need medical attention, and work on rehabilitation. There are so many different ways to treat people with COVID-19, and you can YouTube, you can Twitter, a number of different philosophies on treatment. For me, as a neurological system, I really enhance and focus on rehabilitation. And that's not a bad word to hear that. We focus on trying to improve stamina, cognitive recovery, and that may include patients who deal with occupational rehabilitation, physical therapy, and speech cognitive rehabilitation to work on cognitive enhancement and skills. It's not always about medications. It's not always about being on the corticosteroid or being on the inhaler. We have to really identify the condition, what systems and physical issues are being affected, and try to streamline, because no one person should be necessarily treated the same as the next person. So as you heard, a young person may only have brain fog, where another person may have numerous complaints across the board, and it wouldn't be necessarily, it might be, but may not be ideal to treat them the same. And so, and the recovery is going to be different. So as Dr. CK mentioned about symptoms between about men, females versus males, there are a number of epidemiological data that show women, or females I mean, have actually more notable symptoms versus the male counterparts, and males may have a particular set of symptoms that are very varied and different than the female, and they should be treated differently. So we like to enhance a lot of cognitive, neurological, pulmonary, and cardiac rehabilitation to build many of their symptoms to recover. Certainly, we may have to use supplemental health and medications as that time is necessary. It should be catered individually as best we can. And that gives us a very hands-on, try to do a one-on-one approach to these people and not just the herd mentality and just treat them all the same.
That's important.
And so right now, we don't have any specific, there is no pill to cure this right now, as far as we know. There's a multidisciplinary approach, team approach, that definitely we're seeing improvements in, but there's still much more to learn. But what I want to urge patients who I know are desperate for answers is be careful about anyone who's trying to sell you something. Because, again, there's still a lot of research that needs to be done. We don't have any proven treatments. And I know there's still a lot of research. And so if you want to experiment, technically it should be with a study. And there's a lot of studies on the NIH and the CDC website to look into. I just want to urge caution, as I'm an integrative practitioner, and I do like talking about nutrients and healthy diet and healthy living. But at the same time, I know the nutraceutical industry is a huge industry, and not every vitamin and nutrient is created equal, and sometimes taking some of those nutrients, especially without appropriate supervision, can actually cause damage. So I know, again, a lot of patients are probably seeking out integrative therapies. I think at the end of the day, looking at this long COVID as a chronic condition that, a lot of our providers have to deal with. There's a lot of chronic pain illnesses. There's a lot of fatigue illnesses that are out there that have other approaches that have been shown to improve, and that's where I would look to first. And I love the fact that you're talking about occupational therapies and trying to get that function back through those types of therapies to help out over nutrients and supplements.
Really important pieces of, patient care and certainly of education. Before we go into our final video, Dr. G, in your experience in your practice, what do you think if a patient came to you and said that they don't feel that their provider is taking their concerns seriously? What would be your recommendation? We've heard that sometimes it's a challenging conversation because individuals may be having vast symptomatology and it has been prolonged. What would be your recommendation and experience in helping, patients to have that conversation with their provider?
So, one thing, if a patient has a number of symptoms, especially for the primary care network, and I might digress a little bit, but the healthcare system where we are maxed out on a lot of resources and physicians. And as Dr. CK mentioned, that those who one might term the working class, if you want to call that, especially like the blue collar workers. I hate using those terms, but they would continue to work despite the lockdowns. They got sick more often, they have more disability, and the access to medical care is harder. The first thing I have to say to try to answer your question is you kind of have to start over. If you want to go to your medical provider and try to enforce their particular symptoms, but for the primary care provider as well, I know this could be so complicated. As you're hearing myself, I can't do it myself. I can't do this alone. And And my other colleagues as well who treat COVID-19, we can't do it alone. We need extra hands on deck to help. So if they have a number of symptoms, sometimes you may have to, and probably would encourage pulling the tribe together and work together to help this individual. First thing I want to do is start over, listen to the individual, and validate what they experience. It is real for them. It is a real condition. We may not be able to see the problem. We can't necessarily feel the problem because I can't feel their pain. But if we can validate, say, yes, I hear you. You are one of many who are experiencing the symptoms, and we must come up with some type of plan to help you in some way so you can get back to the life you want to lead. The real challenge is for those who have COVID-19, and this is hard for me to say, there's no promise or guarantee that you're going to be back to normal and be back to where you were. There's no promise or guarantee you're going to be better than you were before this infection. But we do want you to know that we are acknowledging the problem. Dr. CK and everyone here at the Healthcare Agency is doing wonderful work in data analysis to see what we can do. Everyone across the country is trying to come up with the ideal standard of care, if you want to put it. But unfortunately, people will be damaged. And people have been disabled. If we can just get some of these people back to some sense of who they are, I think we'll be better off.
No, that's such an important thing, and I think, you know, Dr. G, I would say on behalf of the agency, thank you for your care and understanding and hearing patients and families, because I'm sure these are not easy conversations, and to the point of the impacts, right, that the illness may have on them long term. As a reminder, we're going to go now to our last video, but if you do have questions, please feel free to send those to us at yourhealthmatters@ochca.com. And with that, I know, again, we were talking earlier about as we enter the holiday season, but certainly we cannot emphasize enough the importance of protecting yourself and your loved ones by getting vaccinated for both flu and COVID-19. We'd like you to now please check out this short video by Dr. Erica Pan, State Epidemiologist from the California Department of Public Health.
I'm here today because I just got my COVID-19 booster and my flu shot at the same time. So everyone 12 years of age and older can get a booster now, and it's especially important for people who are over 50, who have underlying medical problems, and children 5 to 11 years of age can get the original booster as well. The booster is available all over California. You can talk to your regular healthcare provider, seek boosters at a pharmacy, and if you're not sure, you can look at myturn.ca.gov to find a booster near you.
Welcome back to our last segment here of Your Health Matters OC. And we're going to kind of wrap up our show talking a little bit about prevention. And Dr. CK, I know you were just mentioning some important reminders about the vaccine. If you could please share with the group.
Yeah, so we've been talking a lot about long COVID and how, unfortunately, we are still learning more about how to manage long COVID and just learn more about COVID illness. But as daunting as it may be, it goes back to basics. We need to try to prevent getting sick in the first place. And even if you do have long COVID, there may actually be some additional benefit even from getting the bivalent one, to reduce your risk from getting another severe illness. And then also we have seen some anecdotal reports, and there are some studies being done around some individuals having a shortening time period of their long COVID symptoms after receiving a booster dose. So those studies are still emerging, but again, it's worthwhile looking into that data and realizing even if you don't get a shortening of or reduction of your COVID symptoms from a booster, you can at least protect yourself from getting sick yet again from COVID. Because we know that even if you've had COVID 1, 2, or 3 times in the past, unfortunately, COVID is getting smarter and fitter than the previous COVID variants that we've seen in the past. And even if you've had COVID before, you can get sick again and restart all of that inflammation in your system and cause more damage and harm in the long run. So this is where it is so important for everyone to continue to follow preventive measures to protect themselves and their family. And I know that we're coming into the winter season. Aside from all the other viruses that are circulating, you know, our other concern is the other COVID variants. And this is where it is important to get that bivalent vaccine, especially if you are eligible to get it, to protect yourself against some of those variants that you're hearing about that are daughters of BA.5 or any other variant that are circulating you may be hearing overseas or even here in the US.
Dr. CK, since we're talking about, you know, boosters and the importance of vaccine, I know that we often get questions about annual boosters or vaccines. Do you believe that may be the reality of what we see in the future?
I think there are some more developments happening in the vaccine realm of looking at different types of vaccines outside of even just mRNA. So I think it's still early to even understand what it's going to look like in the long run, whether we're going to require a vaccine once a year or twice a year. Again, there's still other vaccines in development.
And in terms of prevention, I know you do a lot of patient, you know, education, Dr. G, and since, you know, you have people coming to you with long COVID, can you share with us what are some of the key prevention messages that you continue to talk with your patient population about?
Well, much of it has been said. Number one is if you know it's people around you have COVID-19 and they may not have symptoms. Just much people have the cold, or unfortunately for our little ones, people around are having RSV. These viruses are around us all the time. And we still would like to be as preventive as possible. And I know it's difficult. We want to get on with our lives. But if you're going to be in a very large group setting and there's no avoidance of it, you may still want to obviously wash your hands frequently, don't touch your eyes and nose, and still preferably wear a facial mask if possible. I know there's some stigmata about it, especially in our younger individuals. They want to feel accepted in going to homecoming and of that nature, but if you can, we encourage it. As adults, we have a choice, and it's still recommended if you go to a medical building, because there are other people ill, is to still wear the mask, have a mask handy, and try to wear it if you can. Again, try to avoid large gatherings. Now, Dr. CK may have some other information because the holidays are coming up and we are going to be meeting with lots of people. And so this is a very critical time to all of us to try stay as healthy as we can around people not of our household and protect ourselves. Wash your hands, wear the mask if going to other people, and get vaccinated. I have 5. I've had 5 personally. Oh, sorry, I hit the microphone. I've had 5 personally, and my flu shot, and it was worth it. So.
Very important.
Another message is, you know, if you do happen to catch COVID and you are high risk for developing severe illness, please seek treatment, because at least hopefully it will reduce the viral burden on you and you can get some symptom relief. And while even rebound is a potential for even if you get treated or even if you didn't have treatment, rebound can also happen for people who are not even treated. So it might be just the physiology of the illness from COVID-19. So we do still think that the current treatments that we have available are effective even against the variants that are circulating. Until I get further word, we're going to continue to provide and allow for people who are eligible to get treatment. And there are different providers. If your provider is not comfortable with treating, CDPH has a website that you can go to for more information. Our website also has information to seek treatment. So again, we want people to test if they're exposed or develop symptoms, get evaluated, get treatment if they're eligible for treatment, and recover. Recovery is so important. Just as with if you get sick with anything, you don't want to push yourself. You want your body to have the energy to fight what it's fighting. So hopefully it can reduce the damage that the illness may bring.
Very important. And I think that, as you said, as the holidays are upon us so quickly here, in summary, reminding everybody, get vaccinated, get boosted. And as you said, if individuals are having symptoms or even the longer term symptoms, address that with their provider. Don't be afraid to have that conversation. And I know we're all very much patient advocates, right? So helping our patients advocate for their own health and the symptoms that they've been experiencing.
And I know there's probably a question out there for me as the health officer, since we just did our declaration for emergency, like what does the next couple months look like? Are you going to put a lockdown through? Well, I mean, we want the public to know that there are many different things that they can do to be preventive. We know how important it is to gather with friends and family, but there are ways that you can do that safely. And just as Dr. G said, it's a matter of hand hygiene. It's a matter of having good ventilation when you're indoors. And if there isn't good ventilation and you're around others who are outside your household, wear a mask. And if you get sick, please stay home, because even if your COVID test was negative, you can have some other respiratory virus that you could potentially spread to others. So in that situation, please stay home until you recover. And when you go back out in public, if you're still having respiratory symptoms but your COVID test is negative, please still wear a mask to be considerate of others. And I think again, I believe that we can get through this holiday season, but it will take everybody gearing up to follow all those preventive measures that we did earlier in the last 2 years.
Wonderful. Well, before we close and give you some information about our next show, I just certainly want to say thank you so much, Dr. G. I know you've got an incredibly busy practice and schedule, and we just really appreciate you taking time to come and share with our viewers and certainly with us here at the agency. So thank you so much for being here tonight.
You're welcome. Anytime.
And Dr. CK, as always, thank you for your expertise and all of the information and things that you continue to navigate on behalf of. So for the audience, our next show is November 15th, and we're very excited for this episode as we will be prepping some healthy food together, as well as some of our favorite family dishes. We'll also be joined by one of our environmental health specialists who will share safe food handling and prep as we cook for our families and friends during the holidays. So it'll be a very special episode at our environmental health test kitchen. And again, we thank you for being here, joining us this evening. Remember, Orange County, that your health matters, and our show focuses on keeping you and your loved ones healthy. So thank you again for being here with us this evening, and we look forward to seeing you on the 15th.